ਅਗਾਂਹ ਚਲਦੇ ਹਾਂ। ਬਰੁਕਲਿਨ ਬੋਰੋ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਐਰਿਕ ਐਡਮਜ਼ ਨੇ ਸਥਾਨਕ ਕਮਿਊਨਿਟੀਜ਼ ਨੂੰ ਭਰੋਸਾ ਦੇਣ ਖਾਤਰ ਇੱਕ ਟੈਲੀ ਕਾਨਫਰੰਸਿੰਗ ਦਾ ਪ੍ਰਬੰਧ ਕੀਤਾ, ਜਿਹਦੇ ਵਿੱਚ ਉਹਨਾਂ ਨੇ ਸੋਸ਼ਲ ਡਿਸਟੈਂਸਿੰਗ, ਫਿਜ਼ੀਕਲ ਡਿਸਟੈਂਸਿੰਗ ਦਾ ਖਿਆਲ ਰੱਖਦਿਆਂ ਸਾਰਿਆਂ ਨੂੰ ਸਿਰਫ ਆਨਲਾਈਨ ਲੈ ਕੇ ਉਹਨਾਂ ਦੇ ਸਵਾਲਾਂ ਦਾ ਜਵਾਬ ਦਿੱਤਾ, ਜਿਹਦੇ ਵਿੱਚ ਉਹਨਾਂ ਨੇ ਗੁਰਦੁਆਰਿਆਂ ਵੱਲੋਂ ਕੀਤੇ ਜਾ ਰਹੇ ਕੰਮ ਤੇ ਜਾਣਕਾਰੀ ਦੇਣ ਦੀ ਮੁਹਿੰਮ ਦੀ ਸ਼ਲਾਘਾ ਵੀ ਕੀਤੀ ਹੈ।
Become intentional about reaching out to the various ethnic newspapers, radio stations, cable shows, and also methods of communications. Speaking to our rabbis, our imams, our Baptist and religious leaders, our Sikh temples, bringing them into the methods of communicating and to ensure that everyone receives the proper information, the proper guidance, and the proper tools on how to deal with this very real disease that is going beyond the boundaries of a particular community and reaching throughout our entire state. Lastly, it is important that the governor and mayor get on the same page. We just had a new mobile testing site, drive-through testing site open in the Bronx. The second one, we have one open on Staten Island, yet we have no drive-through testing site in Brooklyn. The only one that we have that Mark Traeger, the councilman, was able to get was closed down. The Department of Health and Mental Hygiene is telling us no longer to do testing, but the state officials are stating we should be doing testing. We're in one state. There should be one message.
Jaya, do you want to ask your question?
Yeah, hold on. My question is from Borough President Eric. There are still subways. There is no social distancing is maintained. So what are we doing to maintain that? Because there are a lot of crowd, and those who are into daily wages, so they are going to work, but there is no social distancing. So why can't we stop subways for some time, so that till the time this COVID can be cured?
Yeah, it's so important, and there have been many conversations about do we shut down the city completely, as Public Advocate Jumaane Williams has called for, or how do we make sure that we still provide some of those basic essential services? COVID-19, the highest level of fatalities are among those with pre-existing conditions. 94% of the people who die from COVID-19 are dealing with pre-existing health conditions. And so if we close down the city, that population, senior population, still must receive some of the basic services, from food to medicine to other care, that many of the adult daycare centers that were providing a service for them no longer exist now. So we are, number one, calling on the governor to reshape the adult daycare centers so they can provide a greater need of services for our seniors. Then expansion of telemedicine and telecommunication like Zoom or WebEx and other type programs, Skype, that we can utilize better. And then target some of those areas where people are not following social distancing, because how good of a job have we done to actually let people know what that actually means? There were several houses of worship where people were still going in and in close proximity to each other. So we must get that information out, and then we must do a light enforcement. I don't believe we should have the police department having a heavy-handed level of enforcement. We should do a light enforcement to remind people and to encourage people to participate in social distancing.
Thank you so much, and it's a very good, the initiative has been taken from you, and because I'm from the Punjabi TV channel, and it's a Punjabi network, and everybody, it's very right, so people wants to know in their own language so they can understand. There are many people, they don't even read English, they can't even speak English. So it's it's a very great idea, great initiative.
Thank you, Jaya. We appreciate it. Thank you.